A local ICU doctor says Hamilton has quickly become the epicenter of COVID-19 critical illness.
On average, there are just as many patients ending up in the ICU in the city compared to the spring. But unlike the peak last year, there are far fewer staff on hand to take care of patients. Nicole Martin reports.
This has been the biggest difference between this wave and previous waves is the staffing.
The standard in Ontario hospitals should be one-on-one care within the ICU, but at Juravinski Hospital, the critical care lead physician says some nurses are now responsible for up to 4 patients.
The ones that have 3 or 4 assignments, certainly those would try to be the patients that are less critically ill. But there's no doubt we're stretched in the ICU like never before.
Across Hamilton Hospital, 759 staff members are isolating or sick. The CEO of the Registered Nurses Association says others are on stress leave or left the profession altogether after the previous waves of COVID-19. Doris Grinspan says it's creating a dangerous environment.
When a nurse has 12 patients instead of 3, that is drive-through nursing. That is unsafe.
According to Hamilton Public Health, daily hospitalizations and ICU admissions continue to rise.
Approximately 10 new hospital admissions per day on average, and more than 2 new ICU admissions each day. This is already higher than we have seen in previous waves of the pandemic.
The last couple of weeks been the epicenter of critical illness related to COVID and COVID in general across the province. Our rates per capita have been higher than almost anywhere else.
The Nurses Union says 15,000 Ontario residents with nursing degrees are waiting to be certified in this province to work in the hospitals. They're calling on the Ford government to get the College of Nurses to speed up this process.
And there is a provincial program largely supported by St. Joe's called the Virtual Community Ward, and it's available upon referral to COVID-19 patients with high to moderate risk. And this virtual ward provides monitoring for 5 to 7 days so you can remain safe in the comfort of your home. It's just one way to alleviate some of the pressures right now on our hospital systems, Phil.